So what we're going to be doing today is we're going to be discussing how Stanford Health Care hires and retains permanent nurses. And Dave is going to be talking through specific strategies that his team uses, as well as tactics, because we want this to be as practical as possible. We want everyone who's attending to at least have several takeaways that they can implement almost right away. So my name is Iman Abuzeid. I'm an MD by background, and I'm the CEO and co-founder of Incredible Health. I've been in healthcare technology for the last 10 years of my career. What Incredible Health is, it's a hiring marketplace for permanent healthcare workers. We focus on permanent nursing today. Incredible Health, it flips the script. The employers apply to the talent instead of the other way around. And the end result is hiring that happens in 20 days or less especially for experienced and permanent nurses. All right, so joining us today is David Jones. David Jones is the Chief HR Officer at Stanford Health Care. David has over 30 years of experience as an HR leader. He has led several large-scale organizational change and HR transformation efforts. David has a strong track record of driving business results through the development and execution of HR strategies in diverse industries, not just in healthcare. He's done it in e-commerce and financial services, in academic medicine, and now in healthcare. David came to Stanford in January of 2017, and he and his team have transformed Stanford's HR function by fundamentally shifting how HR services are provided, and they're leveraging innovative technology, and they're delivering on the best-in-class employee experience. All right, so I'm going to share slides here that help us guide the discussion. So that's David and I in our bios. There's two big topics we'll be talking about today. The first is hiring permanent nurses and some tactics and strategies there. And then the second area, which I know is top of mind for many of us, is retaining them. What are the tactics that we're going to implement to retain permanent nurses in our organizations? There will be plenty of time for Q&A at the end. We'll leave at least 10 minutes or so for Q&A too. All right, so let's do a quick overview of the problem and that we're all tackling here. So this is even before the pandemic. Healthcare was the #1 employment sector in the US since 2018. 1 in 8 Americans works in healthcare. But our demand for healthcare as a country keeps going up because our population is aging. Of course, pandemics don't help. They add even more demand to the system, but our supply of workers has not kept up with the demand. And so the result of that is we are in a huge labor shortage in nursing in particular, but other healthcare workers as well. We're on track to be 1 million nurses short by 2023. The annual acute care nurse turnover right now is previous to the pandemic, it was at about 18%. During the pandemic, we saw it go up to 19% as a national average. Currently, it's actually at 21.5% is the national average for annual nurse turnover. I know, Dave, Stanford, yours is much lower than that, but regardless, I mean, you had to do a lot to drive that, to maintain a low turnover. And then labor as a percentage of revenue also keeps going up. It's at 48% currently, and so the cost of labor keeps going up. That's what that one means. And then for days to fill, it's taking on average 82 days to fill a permanent and experienced specialized nurse role in the country today on average. Now, some teams are less than that, some teams are higher than that, and it does also vary by specialty and unit, of course. All right, so let's dive in. Let's dive into hiring. So now that we've given the lay of the land overall, and so we're going to walk through what are some considerations for hiring, and we'll go through each of these: shift preferences, compensation, speed and operational excellence, and then commute and location. So let's start with shift preference and flexibility. David, I know that your team's done actually quite a bit of work in this area. Love to hear kind of your thoughts on how you're providing flexibility to permanent nurses.
Thanks, Iman, and good morning. Welcome everybody to this conversation. I just wanted to back up a bit.
Sure.
To some of the context that Iman was setting regarding what's going on in the industry. And we've had this conversation previously, but I have to say that personally, things right now just feel like they're at a completely different place. So many things are just coming to bear on healthcare that are making this challenge, this talent crisis, I think, just much more of a serious issue, really across the country. And I don't think there's any area that's spared from this. And despite the things we've been doing, we're certainly finding ourselves needing new solutions and having to reinvent what we're doing just to keep up with what's going on right now. And in addition to what we've talked about with just the overall shortage, the pandemic just extending is putting more pressure on people. We've had a huge increase in people taking leaves of absence or calling out sick, and that's adding to the pressure. At the same time, the demand just continues to go up. And so my point here is to just say, having to be just flexible, innovative, creative, and resilient is so vital right now. And often the things that may have worked, last year or maybe even last month, we have to reevaluate and reconsider to ensure we can continue to meet the needs of the organization. And so I know you all feel that. I just want to acknowledge that we're all in this together, learning together, working together to be able to support our organizations, our patients, as well as our staff. When it comes to flexibility, as Iman was suggesting, that really has been really important for us, making sure that we do give our nurses as many options as possible. And so let me just also mention that part of your ability to do that has to do with having some availability in the first place. And so it's almost a chicken and the egg. You need adequate staff. And we've augmented it with a lot of travelers in order to give more of the flexibility to our regular staff. And this might have to do with just 12-hour shifts 3 times a week. We've certainly supported folks who've got different life experiences, maybe a working mom who's got childcare, folks who've got maybe elder care that they're dealing with, folks who are trying to go back to school and doing other things. And so we've worked a lot to make sure that we understand a person's situation and in many respects really help them craft a schedule that meets their needs. And so, versus just having a certain amount of fixed schedules that we build in and that work operationally or that work financially or from a productivity perspective, we often start from the view of the nurse to find out what do you need, what works for you, and then how do we build around that. And so again, you sacrifice a bit of operational efficiency when you do that, but ultimately it does help us attract more nurses, retain them, and it helps us to cater to what's important to them depending on, again, what's going on in their life, their life stage, their needs, both at home as well as professionally. So that's been a really big focus for us, and a lot of credit to our nursing and patient care services team. They've been just really great partners and really taken the lead on helping figure out how do we make this work and how do we both support our nurses as well as our operations.
Got it. Thank you, David. So, we work with over 500 hospitals and health systems across the country, and different HR leaders and nursing leaders have different strategies and approaches. So, just to sort of put a point on what some of what you're saying. So historically, we've had, it's been quite strict, frankly. So for example, it's 12 hours. It's 12-hour shifts. 3 days a week or 4 days a week or whatever it is. Or we only have 8-hour shift options. And it sounds like your team has added a lot more flexible options for permanent nurses, including creating part-time positions, and just more flexibility, frankly, on the hours as well, in order to accommodate what the nurses want. And that's essentially been some of what you've done.
Yes, that's exactly what we've done. And again, it's you've got to have a certain base to build on in order to do that, because you're trying to fit the pieces together, and so each one kind of builds on the other. So it certainly helps having a strong core staff, helps having the availability of travelers and other staff augmentation. But around that, again, we are really catering to, as much as we can, the unique circumstances of our staff and the things that they need and request. And so I think we have far more options at this point than we would have anticipated, because again, we've listened and we've tried to really be responsive to what the nurses need, and as much as possible, put them in the driver's seat in crafting a schedule that works for them.
Got it. All right. So the next topic we want to cover when it comes to hiring is the hot topic of compensation, right? Compensation, benefits, the packages that the nurses are getting. And, quick background. I mean, we know from our data, we know that Stanford has the highest compensation in the country for nursing. And a lot of that has to do with your team is dealing with the highest cost of living in the country too. However, there's more to compensation than just like, hey, let's just pay as much as we can. Love to hear a little bit about your thoughts on compensation for nursing, whether it's external, thinking about external compensation or internal equity too.
Yes, lots to consider when it comes to compensation. We are pleased that we think we have the best nurses. We think we have certainly the best organization just as far as the people we care for, the acuity of our patients, just the unique challenges that people come here with. And as you said, Iman, we know that Palo Alto is one of the highest, if not the highest cost of living areas in the country. And so as a consequence, being able to pay what the market demands is vital. And so we're certainly very focused on that. I think part of what we're seeing right now in the industry, which is a bit concerning, is that everyone is just kind of throwing money at this challenge, and that's just not sustainable. Certainly, many organizations just financially, how do you afford that going forward? But also, you're just dealing with, in many cases, a fixed supply, and you're just moving people back and forth, and everyone is able to walk across the street, for the next great deal. And so I think that's a challenge for us. I think we certainly work and think about the total package, and that's everything from the pay, the differentials, how we treat people with various specialties, the career ladder elements that we offer, and there are many non-financial things I'm sure we'll get to in a few minutes. But as it pertains to pay, again, it's not just how we go to the market and pay the highest rates for new grads or for experienced nurses that we're trying to attract, but it's also paying attention to equity. And in many respects, that's even more important because you're trying to keep the people that you hire. And I'm laughing because I always think about when I was in college and I had this big Oldsmobile 98 that my brother gave me, one of these huge yachts, we used to call it, that I used to drive around campus. And I remember having just a minimum wage job part-time while I was trying to go to school and trying to keep gas in my tank. And finally realized when I took it into the shop where I'm using so much gas, there was actually a hole in my gas tank. And of course, I'm talking to the repairman, and we finally fixed it. And we're having this conversation about how it doesn't matter how much gas I keep putting in. If I don't plug the hole in the bottom, I'm just going to be wasting my money. And that's really, I think, the same issue when it comes to the retention. And so when we're thinking about how we attract and get people in the organization, if we're not able to keep them here, if we're not able to take care of our own folks, have internal equity, and pay attention to compensation across the board, we just put ourselves at risk for people going out the other doors. So that's also, I think, a really important part of the equation for us.
Okay, fantastic. But by the way, for all the attendees, I mean, feel free to enter questions into the chat, and we'll try to get to as many of them as we can towards the end of this. All right, so. And another challenge that many HR and nursing leaders are dealing with is competition from travel nurse agencies. And one of the more innovative ideas that we've heard is around not just creating a float pool. We know that many teams have created a float pools, but some teams are going as far as creating their own internal travel agency, right? So this is premium pay that's done for your permanent workers in order to prevent them from going to travel agencies. We know that Stanford hasn't done all of these, but I know for sure you've done the float pool. Curious how you're thinking about some of the some of the things around competing, frankly, against some of these travel agencies and keeping nurses in-house instead of losing them to the agencies.
Yes, great question. And I talk to a lot of my peers around the country who are dealing with this, and in many cases seeing a lot of out-migration from folks working for the organization to going to work for travelers. And I think as with any solution, it's really got to be relevant to your context and to your environment. For the most part, we don't see that issue. We don't see loss to the travel agencies. And I think it's because of what we've already built in as far as flexibility, how we cater to nurses from a scheduling standpoint, the elements of compensation that we provide. And so that hasn't been an issue for us. The float pool really is a big part of what we do, and that gives us an internal group that we can use to move people around and to fill in schedules and to really help cover areas where there are shortages. There are a lot of organizations I've spoken to where building their own internal agency does seem to make sense, and where they're essentially trying to emulate within a part of their organization the features of travel agencies that cause nurses to go there in the first place. And a lot of it does come down to, to the pay, the flexibility, often cash in lieu of benefits, but also just a lot of the flexibility that comes with setting your own schedule and, in a sense, being your own boss. And so, typically when you're doing that, you're still moving the same number of nurses instead of them going to work for another agency that you're competing with. It's your own agency, but often it's still the same nurses in your organization, just moving from one part of the payroll to the next. So I don't know that it necessarily increases the supply. It just keeps you from losing people and then having to compete and pay higher wages. Again, that hasn't been an issue for us, but certainly it's something that we're paying attention to, because we want to make sure that we're able to have the nurses we need moving forward and to be able to support all the challenges and growth going on within our business. Absolutely.
Okay, so a question did come in regarding compensation, and before we move on to the next topic, which is going to be around operational excellence in hiring, this is a question from Wendy, and her organization recently increased pay to lead their market, but it's caused some issues with her current staff. She now has some frontline nurses making more than leadership, for example. And new RNs making the same as someone who's been with the organization for many years. I guess what tips or recommendations do you have, David, to tackle this kind of challenge, and ensuring that how did you do the internal equity piece, frankly?
Yeah, it's an ongoing challenge, and I saw another question asking if we're unionized. We do have a nurses union. The beauty of our nurses union is that they are our own employees who form their own union. They're not part of a national or even a regional agency. And so that helps an awful lot, because they are our own staff, committed to the mission, committed to the patients. But they certainly have been very savvy in terms of the contract and the arrangements that we've built in. And a lot of that does have structure that ensures that the longer a nurse is with us, the more credentials they have, the more they're compensated. And so it does help keep nurses moving along and ensure that as much as possible, we're not hiring new nurses or from other organizations in over top of our current nurses. And this is, I won't say comp one-on-one, because it's becoming really, really complicated. But if you aren't paying attention to internal equity, you really are shooting yourself in the foot. And I know that it's tempting when you're competing with organizations that do pay more. And when you're looking at your budget and you're trying to make everything balance, it makes sense as a short-term solution to raise your starting salaries and to go after those available nurses or those candidates that you're trying to attract. And many organizations do that. They jack up their starting rates, or they do other things to get people in the door. But ultimately, there does become a cost. There's a domino impact, because as you're paying more for people coming in with a certain amount of experience, if your internal staff aren't making that same amount and they've got comparable experience, you're just looking for trouble. And so what we've tried to do is just really slow down, pay attention to how we're compensating people, really look across the organization and know how every decision we make is going to have certain consequences. And we don't want to run into those unintended consequences where we made a short-term decision and then realize now it's actually going to be more expensive, because not only do you have to then go back and rectify the internal equity, it probably would come about as a result of losing people. So you got the cost of turnover, disruption, maybe some loss of confidence from your staff as to how they're being treated. And so I guess my main admonition there is, yes, we want to be competitive on the front end. We want to be competitive in terms of market rates, but we have to build into that the internal equity element and ensure that as much as possible, as we are raising those rates, if it puts us in a position where internal equity is compromised, that we have dollars so that we can move people along internally and keep them where they should be, so that doesn't become an issue. much more easily said than done, and no doubt adds on the cost. But ultimately, if you're not addressing your internal folks, it's a pay me now or pay me later.
Yep. Okay. So the next topic we want to talk about is speed and hiring operations, right? Which is a important topic. So I usually want to do this quick exercise with everyone, all the attendees. We work with over 500 hospitals now across the country. This happens to be data from our LA market, the Los Angeles market. And essentially we have three different teams, three different hospitals and health systems here in the LA area. We've got one that has the highest salaries in that city. The second is, they have the biggest brand. And then the third is they are operating with the fastest speed, right? And so we can see, the number of days candidates are spending in each step of the process. This is something that's tracked very carefully and in a detailed way in our marketplace and in our technology. And so, a question for everyone, who of these three, who do you think hires more? Who hires the most? So Robert says speed. Anyone else have answers, A, B, or C? Feel free to enter them into the chat. Okay, we actually have a whole range of answers. Most people selected C, and that is the correct answer. It's probably one of the most a surprising insight that I had, frankly. When we started this company in 2017, we were like, oh, it's going to be the teams with the highest salaries and the biggest brands that hire the most. But actually, that's not at all the case. It's the teams that can get the candidates through their hiring process the fastest are actually hiring the most and winning in this market. And let's just dig into some reasons why is that the case? So the data on our platform shows that 68% of nurse candidates accept the very first offer they receive. And 61% of nurses are accepting the first offer they receive, even if the second or third offer is has higher compensation. And that's been true even before the pandemic. This statistic has stayed pretty consistent throughout as well. A lot of it has to do with candidate experience, right? So if you've experienced like a great hiring process, i.e. a fast hiring process, and you were able to get through without bottlenecks and without delays, and you always knew what was happening, then you got hired. Then that created a very positive impression of the health system, and you sign the dotted line, right? And the other thing to keep in mind is nurses are very, very busy, including nurses that are doing a job search. Right? They're often working full-time, more than full-time, while they're doing their job search. And so in a scenario like that, where you really don't have time for all this back and forth and waiting and delays and follow-ups and so on, you do tend to go with the team that's moving the fastest. So that's just a key insight that's national. It's actually played out in every single market that we're in, that just wanted to make sure we keep in mind. All right, so one of the things that I'd love to chat about with David here is hiring as an executive priority, right? So, some of the things that David's team has decided is to adopt technology, and that has helped with some of their hiring operations. I included this slide as an example of how they work with Incredible Health. So really, the Incredible Health marketplace technology is taking care of the first 4 steps: the sourcing, the pre-screening, confirming talent's interested, in automatically scheduling that phone screen. And then Stanford team is taking over at that point, and it's the Stanford recruiters, in-house talent acquisition team that's completing those phone screens, completing the hiring manager reviews, sending offers and getting the offers accepted. And that it really truly is a collaboration. What this has enabled is it has freed up recruiter time and hiring manager time, because of the first 4 steps are frankly taken care of with automation. And that has enabled recruiters to operate at the top of their skill set, right? So the top of their skill set is a relationship building with the hiring managers. It's relationship building with the candidates. We talk a lot about, hey, nurses need to operate at the top of their skill set, but so do recruiters and HR professionals too. So curious, David, how are you thinking about hiring performance and operations as an executive priority, and how are you thinking about technology adoption too?
Yeah, well, let me start with the technology. That's certainly a little bit easier, but it's been an area where Incredible Health has certainly been of a great benefit to us, because speed is so vital, and having this part of the funnel taken care of does give us time then to focus on really what's most important to us, and that is those conversations and interactions, both with the candidates, but also with our hiring managers as well. We also have Workday. We've built in a lot of visibility into the process there, and that helps us. And there are other tools we use as well. Technology is definitely a key part of the infrastructure, but ultimately it really does come down to the relationships of the talent acquisition consultants with the hiring managers, and of the human resource team overall with the nursing and patient care services team. And given how vital it is to have the right nurses available for our organization with the type of care we provide, hiring managers are very selective and have lots of specific nuances around experience and certifications, and just the type of patient populations they've worked with, and empathy and just teamwork, and so many things are really important that the talent acquisition consultant has to know those hiring managers, and what their needs and expectations are, and how to match what they're looking for with the candidate population, and being able to have the time to do that, to have those relationships, and really to understand with each of those hiring managers what they're looking for, ensures that you're bringing the right candidates to the table, and that as we then go through the conversations with the candidates, we can match them quickly. In some cases, we even are having more than one hiring manager talking to candidates at the same time, so that if one manager decides this person isn't the best fit, we've got another manager who's there at the same time available to say, yes, this person works for me, and so I can move very quickly to get an offer out to that person same day or the next day at the latest, so that we can lock them in. But again, so much of that does come down to how the talent acquisition team and the HR team works with nursing and patient care services. And as we go further into the conversation, and especially around retention, we talk about the practice environment, we talk about the things that we provide that really make it the place where people thrive. I mean, that really is a partnership between our nursing function and our human resource organization. So really collaborating, understanding what it takes to deliver on the experience, both for the candidates and for the workforce, and also for the patients, really does involve great collaboration, great support. You see here the check-ins with the hiring manager and recruiter, making sure that the managers are trained and understand their role in not just evaluating candidates, but actually selling candidates. As you all know, it's the candidates market right now. And so if we're only grilling people based on skill set and credentials and qualifications, and not really looking at how they're viewing the opportunity and the need to really give them insight and visibility as to what is it going to look like. We've done things to help simulate for people, the day in the life, through videos and through conversations, through previews of working on certain units, so that they get a sense of, what would it be like to work here? And if I came to Stanford and worked on a particular unit, what would that experience look like? And so there are a lot of things we do that way that really help, I think, make the candidate experience more meaningful, give them more comfort that if I move forward with this opportunity, I know what I'm getting myself into. And again, the partnership between the talent acquisition team and the nursing and patient care services team and the hiring manager is vital to make all that work.
Yeah, absolutely. I mean, it's important that the recruiters and the talent acquisition team are operating like consultants. Like they have very strategic roles. One of the most important roles they play is this first point here, is that they educate the hiring managers on what's happening in the market. This doesn't happen at Stanford anymore, but I remember earlier days, like a couple, 2 years ago when we first started working with your team, there were definitely hiring managers who said, we're Stanford, let them wait. Let the candidates wait, we're Stanford. And it's like, no, that's the recruiters have to explain, like, listen, that's not how the market works anymore. The competitors are, beating us on speed and so on. Like we don't have that luxury anymore. Like those days are over. So that's just one small example of really just the role recruiters play around educating hiring managers. Great. And then, so there's a lot of tracking. You mentioned Workday. Of course, your team uses Incredible Health for tracking around experience and specialized nurses. And I think one area I just want to mention here is just around just the importance of the data and the tracking, right? Because it's very difficult to troubleshoot when you don't know exactly where the bottlenecks are. A classic bottleneck that happens with most teams is the hiring manager interview stage. That is a stage that is problematic for many, many teams across the country. The candidate was identified, the recruiter phone screen was done quickly, but for whatever, for several reasons, that hiring manager interview is not getting scheduled rapidly. And then candidates fall off, or they end up going to competitors. So the tracking enables us to identify issues like that. And then going along with these bottlenecks is like, okay, so what are we going to put in place internally to prevent these bottlenecks or to reduce these bottlenecks? I know, David, your team's adopted many of these. So do you want to just speak to a little bit about some of the tactics that you've implemented process-wise when it comes to the hiring processes?
Yeah, a lot of these things have been working for us. I think most people went to remote interviews because of COVID, and we continue that. It's very efficient, helps us process more people quickly. As I said, sometimes we can have multiple hiring managers talking to the same candidates and get a lot of efficiency there. And it really does improve the candidate experience because they don't have to worry about traffic and all that. So that's something that I'm sure most organizations are continuing to do. But I think, again, probably the key thing is just that visibility of the process and where the candidate is and what it's going to take in order to make sure that we move quickly and that we close, that we don't have situations where we lose a candidate and the manager is pointing at HR and HR is pointing at the manager saying, who dropped the ball? When you're able to have the data and the insight as to the flow and the process, and you build in the time to ensure both that you can see candidates when they're available and that you can make decisions very quickly, I think those things are really vital. And again, the combination of what we have been able to gain through Incredible Health and also with our Workday setup has given us just much greater visibility and insight into the funnel, where candidates are, what step in the process, and who owns that next step to ensure that we can get back to the candidate and make a decision very quickly. So, these are the elements of playing the game at a high level that I think we put a lot of work into and have gotten a lot better at. And so certainly those things do give you a competitive edge, especially given the earlier comment about speed and how speed often is the decisive factor in whether or not you're going to get a nurse or not.
Yep, absolutely. Some other very tactical things that teams do is recruiters at the end of that phone screen, before they hang up, before they even hang up on that phone screen, they're scheduling that hiring manager interview. And so having the processes and tools in place to enable that, and frankly, the flexibility from the hiring managers as well to allow for that has been critical for removing that specific bottleneck as well. All right. So one of the things that we've learned with talent acquisition leaders in particular, and HR leaders and nursing leaders as well over the last couple of years, is just the importance of enabling the recruiting and HR team to operate at the top of their skill set. So really, what can be automated? What low skill work can be automated? And oftentimes things like sourcing and making sure the candidate is qualified even at a basic level as far as their hard skills. There is software out there that does enable that. And I know that your team has gone through this sort of transformation as well around technology adoption, so you can operate more efficiently. Are you able to just comment a little bit more on that topic, David? How you're thinking about it strategically?
Yeah, and we've talked about that some. I think it just really is a matter of being relentless around moving out the low value work and optimizing various forms of the ecosystem, whether that's what we get through Incredible Health and others who do some of the sourcing, how we've been able to look at the technology and really build in the process so that a lot of what used to be, paper or manual activities or just a lot of time spent on the process, we're able to reallocate that time to focus on the conversations and on the relationship. Because again, in this game, I think the differentiator is really the relationship between the hiring manager and the talent acquisition consultant, or with both of them and the candidate. And so being able to focus the time on the conversations, on understanding the needs, on really ensuring that experience feels personalized, and certainly that the hiring manager is getting the types of candidates that meet their needs. I mean, that really is where I think we make a difference. That's what really I think is the game changer. And so being able to move those more administrative parts of the process out, which frankly, that used to be the core of what recruiters did, right? Was managing the applications and the resumes and going through those and sorting those and, scheduling meetings and, just doing all the things that really help bring people into the organization and into the conversation. So much of that now is done through technology because again, when you look at what really delivers the value, it is those things that are relationship based and that really call on those skills and the connection and partnership between the talent acquisition consultant, the hiring managers, and the candidates.
Got it. Okay, so let's switch over to the topic of retention. I just wanted to mention before we dive into retention, just a little bit about what we do. David commented around how his team has adopted Incredible Health and strategically why they've done that. So, hospitals, they use our custom matching technology to hire high quality permanent nurses in less than 20 days. The unique thing about our platform is the employers are applying to the talent instead of waiting for the talent to apply to them. As you can imagine, the nurses absolutely love that because they create a profile, they sit back and relax. They get interview requests from multiple employers, and the nurses gets to choose which interviews to accept or decline. We also have proprietary screening, matching, and data analytics that it delivers on the service as well. The end result of that is really cutting the hiring time down, the days to fill, down from 66 days down to 19 days. This is our average right now, I believe, is 16 days. This is a specific case study from one of the teams that uses us. And it's really, the biggest impact is on time to source because we've been able to develop very unique sourcing and ways to attract nurses to our platform, including things like offering free continuing education and having a nurse community in our apps and other creative tactics like that. We're used by over 500 hospitals and health systems across the country, including Cedars-Sinai, large systems like HCA, Providence St. Joseph. Baylor Scott and White. We work with very large systems like Kaiser Permanente as well, and lots of community hospitals as well. I think one of the great things about hearing from David is that even Stanford is experiencing these challenges, right? So if you are a community hospital, you're not alone because these big academic medical centers are having very similar challenges as well. All right, so let's dive into retention, which I know many attendees joined to talk about retention and hear more about that. And this is an area that's very strategic for your team, David, as you've explained already. And we're going to go through each of these factors, like how are you thinking about career mobility and education for nurses, how you're tackling burnout and resilience, and then management training and their emotional intelligence too. So let's dive into career and education opportunities first. So this is an area where your team actually has done quite a bit of work. We'd love to hear more about how you're supporting nurses when it comes to their career and education, and can you link it to retention as well?
Sure. And I don't want to take credit for all of this because a lot of this is work that's been in motion for years, beginning with our magnet journey, beginning with our view of the nursing professional development. We have a very strong nursing administrative team, just a lot of great people and resources there who've thought about, what is the practice of nursing? What does it look like at Stanford? What kind of nurses do we want to bring? What helps them thrive? How do we ensure that they're practicing in a way that is different and unique and that really makes them feel valued and makes them feel like they can make their best contribution? And so there's been just quite a bit of effort that's gone into that from a professional development perspective, defining the practice of nursing, and then all the tools and support that come together around that. We are proponents of caring science, the Watson caring science approach to how we view the nurse's role in the ecosystem of the community of patients and of coworkers and others. And that really helps nurses think about their sense of mission. I think in a broader way, it's not just a job, it's not just patient care, but it's really being part of a community, a healing community, ultimately that helps support others and their growth and development, but also helps that person in their personal growth and their ability to really meet their sense of their purpose and what it is that they want to contribute and offer to the community and to the organization. But then we've built in lots of things as far as professional development, career ladders, the ability to get additional training, to move into different areas within the organization as they get certifications, as they gain new experiences and new credentials, the ability to move up the ladder, to earn more money, to get more diverse experiences. Those things are key part of that, and it's very regimented in terms of the structure and how people matriculate through the organization based on their interests and based on their motivations and what things they want to really invest in. We do a lot as far as succession planning. Most of our leadership positions are filled by nurses who move through the organization, and so there's just a lot of growth opportunity from that perspective, and we support people in being able to get the experiences they need so that as those opportunities are created, we have people ready to move into those roles. And so those things are really a key part of it. And so we really do try to ensure that a nurse comes to Stanford and that they view us as a destination employer. This isn't just a job, this isn't just a place to get Stanford on your resume, but this is really a place to build a career and to be part of a caring community, a part of a family, a part of really something that's larger than themselves. We also have a very strong shared governance program that our nursing administration team leads, where nurses are able to contribute to process improvement, helping with various programs that will help either improve efficiency, the employee experience, or helping address quality, helping address everything from movement of supplies, dealing with specific issues that are of concern to patients and coworkers. And so it really gives them a sense that I have something more to offer than just coming to work and working a shift. I can actually both learn and apply process improvement skills, work with teams, collaborate across the organization, and really help make the organization better. And so, that element of it really does give them that voice and that sense of growth and that sense of contributing, I think, in a significant way. Many, many more things that we do. I mean, I think sometimes when we look at all of it, it's just layering multiple elements that ultimately make the employee experience one that people really do gravitate toward, and that really is very sticky, that people come here and they want to stay here.
Yeah, some very tactical examples that nurses absolutely love is documenting career mobility plans. First of all, having a career mobility plan for every single nurse in the organization, so they know exactly how their career is going to transform and what is it do they want to do? Do they want to cross train to another specialty? Do they want to move into leadership? And that is documented. There's also many teams that implement like a day 90 check-in, a day 120 check-in, where a lot of turnover is happening is usually in the first few months, right? In the first 90 days, first 4 months. And so just enabling more formal check-ins on how that nurse is doing is another tactic related to this that teams have implemented to improve retention too. All right, so let's shift to the topic of burnout and resilience. So, for burnout is tough to define. So I'm going to borrow from Christina Maslach at Berkeley, and really the burnout is focused on emotional exhaustion, and it's nurses who feel overwhelmed, empty, and low energy. So curious, just from your standpoint and your perspective, David, what you're doing and what your team is doing to really tackle burnout. And you mentioned at the top of the hour that you're dealing with more leaves of absence and maybe you haven't figured it all out, but we'd love to hear what you've tried so far.
Yes, I will admit that I don't know that anyone has figured this out, and a lot of it is because when we're talking about the pandemic early on, right before the session, I was talking about this notion of crisis fatigue. And this is something that I talk quite a bit about because we are almost 2 years into the worst pandemic any of us have seen, and it just continues. And as a result of that, we're built to have bursts of energy and creativity and to rise to whatever challenges come. But we're not built for that to just last month after month after month. And so, this pandemic really, I think, is pushing all of us in ways that I think we're going to see play out for many years to come. And so we've done a lot to try to pay attention to that, to try to support nurses with additional childcare support. We've done everything from meal delivery, TaskRabbit support, a lot of additional mental health support, coaching, counseling, I think so many things we've done to support managers, train them in how to recognize signs of burnout and how to support teams. And so I think there's certainly a lot that we've built and put in place, a lot of infrastructure that has been effective, to a large degree. And then at the same time, I think we are also still seeing that people are just feeling the strain and feeling the stress. And so I mentioned earlier that we've had a pretty significant increase in people taking leaves of absence. And so we're actually now stepping back, taking more time to say, what more can we do to understand, what's pushing people to that point? What support do they need beyond what we've already done to ensure that we are getting at what they need? And for many people, it really just is the time away. It's just taking the time, because when you're caring for all of the COVID patients when you're working the extra shifts and the overtime and everything else, at some point, it takes a toll on you. And so we just have to recognize that, we're all human, and that we have to find ways to give people some relief and to build in some of that reflection time and some of that time to decompress. And we've done that in many small ways, but I think there may be more we can do in terms of supporting people, taking a break, getting some time off, taking brief sabbaticals or whatever it might be, in order for them to be refreshed and to be able to come back and to give their best. And so, I think we've done a lot of the things that are identified here. But I will have to say, given how this pandemic just continues to be unrelenting, we feel like we have to go back and give this some more thought. I was talking to one of our physicians. We happen to have Dr. Shanafeld, who's one of the world leaders on physician burnout. He and I have just been spending time thinking about, what's next, what more can we do? And we have other resources throughout the organization that are trying to tackle this challenge. But again, I think right now we feel like there's so much more we need to do that we have to figure out to support people in some really difficult times.
Yeah, absolutely. So there's a cliche, right? It says people don't quit their jobs, they quit their managers. And managers play a huge role in whether a team member stays or goes. Curious how you're thinking about manager training for nursing in particular, and if you could share some of the tactics that you've implemented there as well to kind of elevate the nursing managers.
Sure, there's lots that again our nursing development program has built in as far as support, core training, mentorship, preceptorship, other things that we're providing directly to managers, especially new managers, to really equip them with the tools and the support they need. My team has multiple websites where we have built various training programs, micro practices, videos and simulations and other things that really bring tools together to help managers to be able to learn specific skills, discrete skills and tactics, and get the support they need in order to improve their skills. A lot of what we've done is through our engagement effort. We have a very strong employee engagement program that's really built around putting tools in managers' hands as to how they connect with their teams, how they understand strengths. It's a strengths-based program, and so we put a lot of focus on people understanding their own strengths and then the strengths of their team. And then there's technology built around it. There's the quarterly engagement pulses that we do, but there's also a weekly check-in where managers can actually have employees go to an app and answer a few questions and then have a conversation weekly to check in as to how they're doing, what their loves are, what their loathes are, what their priorities are, what they need from their manager. And so those types of things really help have conversations and give managers insights that they often can't have as to what their teams need and how to support them. And so, those are some of the things we do. It's pretty comprehensive. Some of it comes from our HR team. A lot of it comes directly from our nursing partners.
Yep.
So we want to put the managers in the best possible position to be able to be successful.
Yeah, absolutely. There's quite a lot of academic research as well on nurse retention and the role of managers as well. And some of the behaviors that are included in many of these management training programs include things like how to debrief after a patient death, how to make sure staff are getting meal breaks, ensuring that nurses are getting meaningful recognition, and so they know that they're valuable and appreciated. So it's great to see that there's a whole body of academic research that contributes to this topic as well. All right, so let's dive into Q&A, and want to make sure there's time for that. And by the way, yes, this session is being recorded and will be sent to everyone who's attended as well afterwards. All right, so here's a bigger question for you, David. There was a specific question around how have you partnered with your CNO on nurse hiring and retention? Curious about that relationship between HR and nursing at the leadership level.
Sure. I think that there's a lot of partnership with the CNO just on everything pertaining to patient care, but a lot of it does come down to understanding what the environment is that we need to set and how strategically, we have a vision of the employee experience, the patient experience, and what those critical things are as an organization that we can deliver on. With the CNO, it's probably less about monitoring turnaround time or looking at the dashboard of specific recruiters or hiring managers, and it's really more about how we set the tone for the kind of organization that we want to create, and just all the things that we do in terms of our people strategy, our nursing practice, and just really ensuring that all of these things align, and that the HR function really is working collaboratively with the nursing function to ensure that that vision is able to be delivered on. Because it's one thing to have nice websites and have nice philosophy statements about your aspirations and what you want to be. If that's not the lived experience of people in the units, then obviously it's not going to work. And so making sure that we take the time to see where we need to align those programs and practices and bring that support together, make sure that various elements of the HR infrastructure, do come together to help deliver on what that vision is. Those are the kind of conversations that we have with the CNO. I mean, we both, we're talking multiple times a day, texting, calling, have a lot of meetings and structures and other strategies in place to ensure that we can actually, again, both be on the same page as to what that vision is, and then to align all of our various programs to be able to execute on that.
Okay, great. So another question, and I know you've done a lot of work in this area, is employee engagement, right? So what role does employee engagement play in nurse retention, and how have you measured it?
Yeah, I was mentioning that a bit. So we partner with the Marcus Buckingham Company on their engagement effort, and we do a quarterly pulse survey, just 8 questions, although we actually can add different questions depending on what else we want to learn about. But it really is a tool, and it's really designed, it's evidence-based, it's research-based. It's designed to understand what are the practices of the highest performing leaders, and how do we embed that in the technology of the engagement process, both through the questions and how we respond to the feedback from the pulse surveys, but also the weekly check-in, where the employees have the opportunity to do the check-in on an app or on a computer, and then the manager is able to follow that up in terms of the conversations they have and the way that they support their employees. And so that effort has been really important. Our engagement scores are very high, and I think they reflect, again, our attention to the kind of employee experience that we're trying to create. But it absolutely gives leaders the tools to be able to know who their staff is, what their strengths are, what their needs are, and how to ensure that both as a team and as individuals, that those issues are being addressed.
All right, fantastic. A quick comment from Moses from earlier. He has found Moses Aguirre. He's found internal travel agencies to be very helpful in his organization, especially if the organization is large, right? Because then if it's covering multiple states or multiple facilities, I mean, that's a situation that is great for creating an internal travel agency. It was great. So great to see that as an example. Another question, this is from Teresa at Johns Hopkins. So sign-on or retention bonus? Her opinion is retention bonuses are better than sign-on bonuses, but curious what your thoughts around sign-on versus retention bonuses, David.
Yeah, so for a lot of the things we've been covering today, I don't know that it's an either or. I think it's
both.
We have to have as many tools as we can available in order to bring them to bear on solving the total problem. And so there's a time for both. I mean, obviously, if you're trying to distinguish yourself to the candidate market, the sign-on bonuses can be helpful. The risk there is that often those are easy to replicate, and again, you just find yourself, trying to outdo one another. But again, if you've got a short-term need and you're trying to find some way to distinguish yourself, they obviously can be very helpful. The retention bonuses, that's important because you want to make sure that the people that work for you aren't attracted to somebody else's sign-on bonus. And so it may be a defensive tactic to keep people from leaving. And, we've certainly done it for those reasons, and also just to make it harder for people to feel the need to leave. And so we've used both of those tools. Again, I think having the infrastructure we've talked about as far as the practice environment and all the things that hold people is even more important, because you want people to, once they come here and they start working here, that they feel like this place gets me. I love it here. I've got coworkers who share my values. I've got leaders who want to help me be my best. I'm able to, really do meaningful work and feel like I make a difference every day. And so in many respects, that to me is the secret sauce, and that's what we try to offer. But yes, the compensation elements can help you at different times to just address specific needs. But again, it's got to be, I think, in that larger context.
All right, fantastic. So this is another sort of a detailed question back to employee engagement. Is there a specific app or technology that your team uses for nurses communicating weekly or regularly with their manager? Is it something that your team had implemented technology-wise, or was it built in-house?
Yeah, so I was talking about the app earlier, and it's a branded product from the Marcus Buckingham company called Standout. And so there is an app that is on the phone, or that people can access through a desktop or go to the website. But it does give them the opportunity to enter a response to certain questions. The option is there to do it weekly. We right now, I would say we don't have as many employees doing it weekly as we'd like, just because with some of the demands and also with some of the large spans of control that managers have, it's sometimes difficult. But for those who use it, it is a really great tool because again, you do get that direct feedback from your staff. You get to have conversations around specific issues and concerns that they raise. And I know we've seen across the organization, leaders have different conversations with that insight than they've been able to have before. And so it really is very, very helpful.
All right, fantastic. So we on the slide here, just sharing a screen around our email questions@incrediblehealth.com. So the conversation can continue. Feel free to submit your questions there as well. Donna from Fresenius, you had a question around at what point in your hiring process are references completed, and are references contingent, or offers contingent upon receiving the references? I'm not, David, I'm guessing you don't. We can follow with your TA managers about that specific answer. I'm not sure that. I'm guessing you don't know the nuances of exactly what happens with nurse references.
I wish I did know. I don't.
So we'll definitely do a follow up with Donna on that after we get the answer. But if anyone else has, I know we're at time, so if anyone else has questions, please feel free to email them, and we'll do our best to get you the answers. And just, David, thank you so much for joining us today and for sharing some of your insights and thoughts and specific tactics as well, and strategies and how you're thinking about nurse hiring and retention. And thank you everyone for joining as well.
Thanks.
All right. Thanks, David.